Hello, my name is Dr. Dewan S. Raja. Today I will discuss about fatty chains, also called steatosis. We'll also cover fatty liver. It is the accumulation of triglyceride in the parenchymal cell resulting from excessive intake or decreased transfer because the transfer protein is defective, so transfer is not possible, and the person take too much fatty meal, there will be more triglyceride. So due to excessive intake, it will be accumulated in the parenchymal cell. Parenchymal cells means the cells, suppose in the liver, hepatocytes are the parenchymal cell. So it accumulates in the parenchymal cell and result from excessive intake or decreased transfer. Fatty change is most commonly seen in liver since liver is the major organ for fat metabolism. Liver is also the major organ for carbohydrate and protein metabolism. Okay, fatty change also occur in heart, skeletal muscle, kidney, and other organs. Fatty change is reversible, especially to the alcoholic person if the person is abstain from alcohol in the initial stages of alcoholism, then fatty change is reversible. Causes of fatty change include toxin, alcoholism, protein malnutrition, diabetes mellitus, obesity, hepatic congestion. Hepatic congestion may happen due to congestive heart failure. Anoxia. Anoxia may cause fatty change, also cause damage to the myocardial tissue. Adverse effects of drug like that of tetracycline, valproic acid, okay, and adverse effect of drug also include aspirin. If the aspirin is given to a child who has viral infection, there will be Ray's syndrome. There is a fulminant hepatic encephalopathy may happen. So aspirin if it is taken to a immature or premature liver of a child, the child's liver is small and it is not yet mature. If due to any reason he has viral fever, if we take aspirin, then there is chance of Ray's syndrome. Okay, it may happen, fatty change may happen due to hepatitis C, especially the genotype 3 type of hepatitis C. Wilson disease. Okay, Wilson disease is important to us. Wilson disease is a disease of copper accumulation. Copper metabolism is altered. There will be hepatolenticular degeneration. There will be Kaiser-Fleischer ring at the sclerocorneal junction. Okay, so we'll get fatty changes in the liver in Wilson disease, and also fatty liver of pregnancy that rarely happen, not very common, but some women may develop fatty liver of pregnancy. Okay, so here in high power detail of fatty change of the liver, this is the fatty liver. Liver, in most cells, the oil preserved nucleus is squeezed into the displaced rim of the cytoplasm. So the nucleus is gone here. Nucleus of what? Nucleus of the hepatocyte, the parenchymal cell, and we'll get rim of cytoplasm, and this is the fat vacuole. Okay, so fat vacuole is here like this. Nucleus is at the periphery, okay, with very thin rim of cytoplasm, and this is the fat bubble. This is a feature of the fatty liver. Okay. Okay, so as I mentioned, fatty liver mostly seen in the liver. mean the fatty change mostly seen in the liver. Okay, it may happen in the kidney, may happen in the muscle, may happen in the heart, but the fatty change is mostly seen in the liver because liver is a site of metabolism for fat. This is the normal liver. Then the person is exposed, there is exposure to alcohol, or person has diabetes, long-standing diabetes, some type of drug effect. Okay, so just we consider alcoholic liver disease, exposure, there will be steatosis, fatty chains, periventricular, perivenular fibrosis. There is the perivenular means around the central vein, there will be fibrosis initially. Then it will spread to the periphery, to the portal triad area. But initially, fibrosis begin around the central vein. But if the person is practicing abstinence, then it will go back to normal. Okay, continuous exposure to these substances like alcohol lead to cirrhosis, fibrosis, hyperplastic nodule. Okay, from normal liver, severe exposure to the alcohol, there will be hepatitis, liver cell necrosis, inflammation, Mallory body. This is a inclusion body and fatty chains. This is also reversible. Okay, and abstinence will make the person almost normal here. Okay, may not be like this, but close to that. Okay, abstinence, it will go in that direction. And here, repeated attacks of hepatitis, usually hepatitis C, okay, the species, the genotype 3, okay, liver cell necrosis, inflammation, Mallory body, fatty change, repeated attack will get cirrhosis of liver, fibrosis, hyperplastic nodule. Okay, so from cirrhosis of liver, we may get liver cancer, hepatocellular carcinoma. So let us get the statistics. 90% to 100% of heavy drinker, means alcoholic person, develop fatty liver called hepatic steatosis. 10 to 15% of hepatic steatosis develop alcoholic hepatitis. Okay. 8 to 20% of chronic alcoholic develop cirrhosis. Steatosis, hepatitis, and fibrosis may develop subsequently, one after another, or maybe independently. Hepatocellular carcinoma arises from 10% to 20% of patients with alcoholic cirrhosis. Okay, and that's all about the fatty change and fatty liver. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.